Welcome to Verto, the emergency room assessment software for retinal skew. To get started, please log in with your username and password. To search for a patient, begin typing in their first or last name or medical record number. Select Confirm to continue. You should now place the face bow on the patient. The software will prompt you to calibrate the device. This will ensure that both the patient and machine are horizontal with respect to the plane of the Earth before starting the test. On the computer, a live image of the patient's eye will be displayed. To indicate which eye you want to image, click OD for patient's right eye or OS for patient's left eye on the machine. Using the joystick, you are able to move the camera and capture an image. Below the live preview, the photos that you have taken will be displayed as thumbnails. The computer will automatically calculate the regions where the optic disc and macula are located on the image of the eye. If you believe the placement of the dashed circles are correct, click Continue. If not, the positions can be moved and the sizes of the circles can be expanded or shrunk. There is a minimum and maximum size limit on the circles. To understand this interface, it is important to know how the 2D image of the eye corresponds to the 3D eye and what the various tomograms or cross-sections of the eye represent. As the horizontal cross-section moves downwards on the 3D eye, you are moving in the negative y direction of the 2D image of the eye. You will notice that there are two divots in the 3D eye, the larger one for the optic nerve and the smaller one for the macula. You can see that the divots in the 3D eye correspond to the dark spots on the 2D image of the eye, as well as the dips in the tomograms. This information is how the machine will determine where to initially place the crosshairs on both the optic nerve and macula. Analogously, as the vertical cross-section moves from right to left, you are moving in the negative x direction on the 2D image. To change the position of the crosshairs, click and drag to a new location. You will see that the sliders and the images on the tomogram will have changed accordingly with respect to the placement of the crosshair. The purpose of the tomogram is to help you with the fine-tuned placement of the crosshairs. When you have determined that the crosshairs are placed in the correct location, click Analyze. The computer will automatically calculate the disc foveal angle with respect to the horizontal line. The results consist of the disc foveal angle for both the left and right eye, as well as the discrepancy between the disc foveal angles. To upload the test results to the patient's electronic medical record, click Upload. To print a PDF of the results page for the physician, click Print. Thank you for using Verto.